Hello, everyone. Welcome to the Multiple Myeloma Patient Physician Partners Program. My name is Tiffany Drummond. I'm an advocate who has worked in cancer research for 20 years, but more importantly, I became a care partner advocate when my mom was diagnosed with endometrial cancer in 2014. Her journey led me on a quest to find out as much information as I could to help with her care, and it wasn't easy to find. And that's why we at The Patient Story put on programs like this one today to help people navigate life after diagnosis. This program is hosted by The Patient Story. Our multi-platform organization aims to help people navigate life before, at, and after diagnosis. In human terms, through empowering patient stories and educational discussions just like this one, focused on how patients and caregivers and their partners can best communicate with their doctors as they go from diagnosis through treatment with myeloma. We want to thank the Leukemia and Lymphoma Society for its partnership in this. The LLS offers incredible free resources like their information specialists to help you communicate with members of your healthcare team and provide information about treatment options. Now, before we get to our speakers, we want to thank our sponsor, Sanofi, for its support, which helps us to host more of these programs and for free, always, to our audience. The Patient Story retains full editorial control over all content as always. Now, I hope you found this helpful. Please keep in mind, this program is not a substitute for medical advice. One last thing, we know that there is a lot you want to know more about and that you want to discuss or at least tune into. Please let us know what those are, along with what we could do better. A survey will pop up after the program ends, so make sure you stick around, okay? Now, I hope you aren't tired of seeing my face or hearing my voice yet, because yours truly will be leading today's conversation. So sit back, relax, and get ready for an engaging conversation. Hi, everyone, and welcome to The Patient Story. My name is Tiffany, where I lead programming and partnerships, and I am so excited to share with you our multiple myeloma patient physician partner program that we're going to be doing today. And I have two exceptional guests. I have Cyndie here, who is a patient, and I have her wonderful doctor, Dr. James Berenson, who is a hematologist oncologist at the James Berenson Cancer Center in West Hollywood. He also serves as president and CEO of the Institute of Myeloma and Bone Research. So thank you both so much for being here. And I don't know if you know, but this story is personal to me when it comes to cancer and care and patient-physician relationships. And so I kind of want to really start with you, Cyndie. Before we even get into that, kind of tell me, what your symptoms were leading up to even needing to go see a hematologist oncologist. What was that experience like for you?
Absolutely. So I was having a little bit of back pain, but really was prompted to go get attention when I was got a routine DEXA scan and was told to take Fosamax, and I decided to see a bone specialist instead of that, and instead of going on Fosamax, and the bone specialist found the myeloma.
Right. And so, again, I think we kind of talked about this a little earlier off camera, but, take me through that and what made you have this sense of, I'm not just going to take this first, opinion that was given to me. I kind of want to go and really talk to someone else and see if there's something else here.
I mean, I had an initial, my first career was as a critical care dietitian. So I had some experience in a hospital, and then also had a sister that had a lifelong illness. And I think I just realized to trust my gut. I think leading a business for a long time, I think I developed those skills to listen to my instincts and just knew that I wanted to see a specialist.
So this leads me to another question. A little birdie told me that you do not live in West Hollywood, California. So how did you get to the Berenson Cancer Center in California, in a whole, like other states?
Yeah. Yes. So I started at a top 10 cancer hospital. I was diagnosed right at the beginning of the pandemic and really didn't have an option. And so I did kind of the standard, run-of-the-mill treatment that every myeloma patient gets put on, and had a transplant. And I always knew that I would get a second opinion when things opened up. And when they did, I decided it was time to get a second opinion. And I started researching, and Dr. Berenson's name kept coming up over and over and over again. And so I just decided he was where I was going to start.
So I think this question might be important to some of our patients out there who aren't really familiar with how to navigate the cancer care in terms of insurance. And so for you, was that an issue? Just, having to go to a different state, did that affect your insurance at all? Or was it something that was more seamless for you?
It was fairly seamless. My insurance is national. And so, and he, accepts lots of different kinds of insurance. And so that was not an issue at all. And I've had a great coordinator, that kind of came alongside in case I had any issues. And so, not that you don't have to fight. I mean, I would also say that the Berenson team absolutely fought for my treatment to get it covered. And so they're very skilled at navigating insurance as well. And so I really appreciate the teamwork on that end.
Absolutely. Thank you, Dr. Berenson and your cancer care team. So this brings me to you. And at the patient story, we do a lot of stories on patients, but I do feel like the patient story also incorporates the healthcare team, which brings me to you, Dr. Berenson. Before we even get into that, for those out there, can you really explain at the basic terms for us what multiple myeloma is? Because maybe if you're newly diagnosed and you're just kind of just getting this information, if you could just say in its basic terms for us, what is multiple myeloma?
So multiple myeloma is a form of blood cancer, but it's really bone marrow based, and it involves a type of white cell called a plasma cell. And the job of plasma cells to make antibody. It turns out that normally one plasma cell makes one antibody, and about 0.5% of your cells in your bone marrow are normally plasma cells, and each one of them makes a different antibody. What happens in myeloma, since it's a clone, it starts with one cell that just keeps dividing and dividing, and eventually there are billions of these cells in the bone marrow. So the protein in the blood, the antibody, sticks out like a sore thumb and tells the patient there's a marker for myeloma. And then that myeloma can cause bone destruction, blood count problems, because it's in the bone where you make all your blood cells, kidney problems, or high calcium from all the leaching out of calcium out of the bones. And patients with myeloma are doing a lot better because of all the new treatments.
Right. So, and it seems very complex, right? So for someone like me, this is very complex work, as opposed to when we think of a solid tumor and there's just a mass that we're looking for. So thank you so much for explaining that. So, so now that I know that you get patients that pretty much come from all over the country for you, how do you approach your patients? And in Cyndie's instance, when she already saw someone, what is it your initial consultation conversation like? And what general questions are asked, and what general information do you give at that initial consult when you meet a patient?
Yeah, perfect example. I just saw a new patient an hour ago, came in from the kidney doctor because his kidneys were a little off. And the big thing here is to make sure you take into account the whole patient. So a lot of things, everybody blames everything on myeloma. So this patient's anemic, but it turns out he's probably iron deficient. He's also got kidneys don't quite work right, but that may be from his diabetes and may in fact not be from his myeloma. And so what happens many times is patients have such a blinders on type doctor that they blame everything on myeloma and they throw the kitchen sink. And the patient, I've seen this all the time, may just have iron deficiency. He doesn't even need treatment for myeloma. May have kidney disease because they took too much Advil, or maybe from diabetes or high blood pressure. So one has to think about the whole patient, not just about the myeloma when you see them, and take into account what are their goals for treatment? How old are they? What's their quality of life? What are their expectations? Do they want to travel? Do they want to stay local? All these things come into account. It's not just myeloma.
Right. And I know you've been doing this for quite some time and you're well known in this space. And so I do take into account all of the things that you're saying. And I think that will lead to, other healthcare providers, hopefully, getting some bells rang up in there. And so which brings me to what I think you're saying is shared decision making, which kind of brings me to you, Cyndie. So, when you wanted to come for this second opinion, you wanted to go to Dr. Berenson's Cancer Center where you're getting this treatment. How did that look for you? Did you already have in mind kind of what your quality of life needed to be in order for you to sustain yourself? Or did you say, I want to see what Dr. Berenson has to say first and kind of go from there? What was that like for you?
So I think that my previous experience was that I was put into some pretty hardcore treatment, and it was very kind of fear-based and not quite as helpful. I'm a very positive person, but I think that was probably the biggest difference when I went into Dr. Berenson's office, is that we really did discuss that. He definitely did look at me as a whole patient and explain things incredibly thoroughly. And I'd had myeloma for 2 years. But I think as he described the plan that he wanted to put me on and why he wanted to, due to my age and, for me, take me off of a chemo drug and put me on a drug that he actually studied. And it's been amazing. I mean, I honestly am doing things I didn't think I'd be able to do, and I have no hesitancy doing them. And that's one of the things that I so appreciate is that, I am youngish, have this disease, and I live a very carefree life. I have virtually no side effects from the treatment I'm on. And he had me in complete remission within, I would say, like 2 months of starting this treatment. And I had not achieved that after, all the hardcore chemo. So, but he definitely has a conversation and tells me his reasons why. I mean, recently I asked him if I could go down on steroids, and he, we discussed it and what my goals were. And then ultimately, I absolutely trust his judgment. I mean, he's one of, if not the best in the world, but I appreciate the fact that he takes the time to explain why he does or does not want to do something.
Yeah, this brings me to a question for both of you, actually. So, I do kind of think this, I don't know, you give me this, Dr. Berenson, that you have this novel approach to the way you do care. And so for you, do you find that most of your patients are open to that? Because some patients really just want the basic, right? Like you say, Cyndie, fear-based. So like my doctor told me I have to get this, it's going to be toxic and these things like that. But I feel like in order for me to get better, I have to do that. As opposed to someone like Dr. Berenson who said, we're going to do this, right? Which is maybe a novel approach outside of what, is being done, everywhere else. And so I kind of a question for both of you is, how do you approach that when the actual treatment plan isn't something that is kind of like a standard? So I'll start with you, Dr. Berenson.
I have the outcome data now to say we're doing well. Our patients are living longer. And as my daughter made up our little saint, they're living better and they're living longer. And she actually had this little tie-up with our logo from the Cancer Center, BCC, made up for my birthday last month. And I think that there's nothing better than to see you walk into our clinic, you don't even know anybody's got myeloma or sick, because we don't make them sick with treatment. And yet they do well. What she's getting is not an approved treatment as a single agent, but we published it works great. There's another antibody in the company that makes it, and another drug said you have to use them together. My 90-year-old who's been in complete remission for 5 years would disagree with that. I'm not going to say everything works in every patient. It doesn't. But I'd rather start slowly and give drugs in a way that people don't get sick. I mean, most oncologists don't understand that the goal here is to give patients a long life that they can have with great quality, not just a long life. I mean, there's two things that happen. But I also think if people are living with better quality, they're going to live longer. And I think that's shown in the results from our own patients over the last 20 years.
Right. I mean, I think you both are the epitome literally of a patient-physician partnership, where just in your communication, where you're talking together, that you come with these plans and that you're very trusting of each other, and that this plan is what works for you, right? And like you said, it doesn't work for everyone, but your data is clearly showing that, which I think is promising. I hope you're sharing that with everyone.
Yeah, I mean, the other part of the story, of course, is the hands-on approach here. I mean, everybody has my cell phone. I don't care when they call me, day or night, just like my old internship many years ago. I don't care. It doesn't bother me. If I were a patient, my daughter had a problem last Friday that a GI doctor helped, and we were all over it within an hour or two. And that's how I respond to my patients, just the way I do my family.
Yeah. And in fact, Saturday I had a GI problem, and Dr. Berenson had me on the phone with his
GI doctor.
The same GI doctor.
Yeah. And I think that being available, not even being that smart, but being available is such a big thing. Like the patient who comes in with neck pain yesterday and had cord compression lower down. And I got his MRI yesterday afternoon. Thank God he didn't have anything in his neck. But by God, if he did, we would have been all over it that afternoon to the surgeon, the radiotherapist. We respond immediately. And I think that really makes a huge difference on outcomes. not just throwing the right brews and cocktails together of drugs, but be available for all these other things and try and sort them out so they don't become major problems for the patient.
Which is actually interesting. So this question is for you, Cyndie, and the second part for you, Dr. Berenson. So for those of us who don't understand your treatment plan, how often do you have to travel to see Dr. Berenson? And what does that look like? Do you have a local healthcare team that, communicates with, shares your medical information? How does that work? I think a lot of people are probably thinking like, how does she go to this other state and she has other, healthcare providers? What is that like?
So my treatment is every 2 weeks. And so up until just recently, I traveled every 4 to 10 days and had treatment. And so we've created a kind of a special arrangement where Dr. Berenson is my primary and does all of my oncology, all of my myeloma blood work. And then I receive one treatment a month here. And then I go out there for a week once every 4 weeks. And so I think I so appreciate the fact that, he's willing to talk to the oncologist here if I need to, but honestly, he has me in such good shape. Now, I'm going to tell you, if anything changed and for some reason, if I needed a different treatment, I would go out to California more frequently. And so he does say it's a hands-on approach. However, when you talk to him, you realize that he has an understanding of this disease in a patient like no one else. And so, my kids and I all want me in his care.
Absolutely. So Dr. Berenson, can you talk to me about you monitoring from afar? And has the pandemic even changed how you do that, right? Like, is telehealth part of your care now? And what is that like for you when you have patients who don't live in your local area?
Yeah, I mean, I did a consult with a guy in Tel Aviv on Saturday, and his doctor's actually the head of Israel's myeloma unit. And I wanted to give a drug that actually Cyndie's on with another one because he has a very specific genetic marker. And it's sometimes hard to deal with these other countries because they don't have approvals and these people can't get drugs. It's very frustrating. But I do telehealth with people all over the country and around the world. And I'm aghast at some of the care. Like I have a patient in this beautiful Kamloops Lake Resort up in Nelson, British Columbia, and he's getting his care, you're going to laugh, in Nelson from a primary care doc for his myeloma. And yet there's an incredible myeloma doctor I know well in Calgary, 150 miles east. He can't go there. It's outside the province. And he's got a marker in which he would do beautifully on what Cyndie's on in this pill, but he can't go. And this is really frustrating for me because you know what to do, but your hands are tied by a government's policies. It's just really frustrating.
Right. And I can understand that, especially when we're dealing with different regulatory authorities. And I used to do regulatory, so I totally understand that. So, I do think that, that your relationship is one that I think a lot of patients want to have with their physician. And so, Cyndie, for you, what makes your relationship with Dr. Berenson so successful, and that, you want this lasting relationship, your family wants you under his care? Like, what do you think makes it so successful for the both of you?
I mean, I honestly would say that he is a very unique physician, as well as.
But I do have an identical twin brother, as she knows.
Yeah.
There's
Who
two
I
of us.
haven't met, so I can't speak. I can't speak for him. But what I can say is, I would love to meet him if he's anything like you. That he is an outstanding human being as well, and he absolutely. There was another patient that I know that said, like, this is a passion. It's not just, his profession. And so I think I do believe that I'm positive, and because I had a different experience, I so appreciate the way that he practices medicine and the thought behind how he approaches his patients in the clinic is filled with hope. I just really appreciate the way that he treats me holistically, and it's not fear-based, and it is, I'm positive and I respond to that. And I think I'm not alone in this feeling about him. You could survey his patients and I think you get similar responses over and over again.
So, Dr. Berenson, I know you're very humble, but you're going to have to not be humble right now. What makes you so successful that your patients literally travel hundreds and thousands of miles to see you and want to keep coming back? What do you think it is about you that makes that relationship so special where they feel that they're getting the best care besides you being brilliant?
Well, because we have the best survival rate in the entire world by far that nobody else has. We do, and we just update and we'll be publishing that. So I can't say what it is right now, but it's even much better. So if I were a patient, I want to, I always say, and it relates to the presidential election, let's not let facts get in the way of opinions. Show me the data. Let me look at it. Let me peruse it. Now, that will not tell you the quality of life data, but I always say if you're feeling better, you're probably living longer. And I'd also, I don't think there's very many oncologists that give up their cell phone. I do. Everybody has it. The new guy today, call me. I don't care when you call me. I had a patient that was worried she had dents in her skull, which turned out to be nothing. But, she was freaking out Sunday. I said, come in tomorrow morning. I'll get x-rays in the clinic. I'll do your, and I could just reassure her, you're fine. I mean, I know because I see that happens with my family sometimes, like that worried about my daughter and maybe having appendicitis. You don't want that anxiety. You want to get rid of it with reassurance, or for example, just what happened over the weekend with Cyndie. Get her to the guy who knows. I don't know about her gut, but I know the guy was the smartest guy in LA to deal with it. So there you go. So, figure out a triage too. Figure out what you don't know. Don't pretend you know everything, and know your own limitations. I think all that comes into play, but I think big thing is availability and willing to think outside the box, not being afraid to try things. I think it was said by one of the drug company people last week, I use drugs in more combinations than any oncologist to treat myeloma in the world. I'm not afraid. I'll try things. And sometimes you blow it doesn't work. But I'm so quick also to respond because we in fact have a new marker that's allowing us to respond. As one of our board members says, you guys are like email and the regular markers are like Pony Express. So you can respond quickly if something's going awry. And that's really cool. In fact, the woman I bone marrow on, she's the first person in the world going on a trial using that marker to make a clinical decision. So we're very excited about that.
That brings me, we're going to be closing up soon, but that brings me to another one. Cyndie, have you ever been on a clinical trial or have you not had to go on any? You've not been on a clinical
She
trial?
is on one. She'll not confess. We follow our new marker called BCM in her like every other patient. She's not on a drug trial, but we are using that to predict outcomes. So
yes, I do know that. I did know that.
Okay, so that is a clinical trial as well. Okay, so this is my question for you, Dr. Berenson. How do you conduct other clinical trials at the Berenson Cancer Center, or do you kind of keep it where it's more investigator initiated, where you're kind of developing it yourself?
No, we what we try to do is spread the love. We start sometimes on the whim that we'll try a drug and repurpose it that may be approved for something else, and then we'll get an activity, and then we'll go to the company to spread the love and do it with other sites around the country. Sometimes we'll piggyback on larger drug company sponsored trials. And I'm more interested in trying to figure out, in some cases, how to use less drugs so we have less cost to the system and less side effects for patients. Perhaps we're going to be able to intermittently treat now with some of the newer drugs and the better markers we're going to have to track myeloma.
Absolutely, absolutely. So this conversation has been great. I don't want to keep up all of your time, but I do, Cyndie, want to ask you this question again. I think, again, it's going to be evident to anyone who watches this program how this patient-partner relationship with you and Dr. Berenson works. You all seem like best friends right now. So I know that you have this great relationship and you do with all of your patients. But for Cyndie, for you, if you could give someone out there advice who may be newly diagnosed or even relapse refractory, right? Any of those things, what is something that you wish you knew in terms of, I wish I felt comfortable enough to go to my physician or my oncologist to say this? And so if there was some advice that you could give out there, what would that be? I know that's kind of loaded, but what do you got?
No, I mean, I have thought about it. I think that if I had known, I think I would have asked my initial oncologist, what are the other options? Although really it was very directly said to me that this is really the only way to go. What I tell people though is I tell everybody that they should at least try to get a consult from Dr. Berenson before they start treatment, no matter where they are in the country. And that if it wasn't the pandemic, then like that's the way that I would have gone. would have investigated. And then, I wish that I had started with him. It would have saved me from getting a transplant, and all kinds of chemo. So.
Right. And I'm pretty sure there's some people who feel out there that they're kind of stuck in one place.
Mhm.
But I can say this just as someone who's patient advocate, that there is no one replacing Dr. Berenson. There may be someone close to him in your local community.
Mhm.
Find that one person if you can't get Dr. Berenson, but Dr. Berenson might give out his cell phone number. I'm not sure, America. I'm not sure. But with that being said, I want to.
You have to try to push the what people should be doing, what should be the norm. The norm should be availability. The norm should be that you actually touch a patient and examine them. The norm should be that you spend enough time to find out whether their eyes, ears, nose, throat, or something else is going on. That should be what we allow. We shouldn't allow this kind of hands-off and less involved approach to occur. So people are talking about personalized medicine. I find it rather ironic in a time when medicine is so much more depersonalized. And I don't think that's the idea of personalization. It's, to me, individualizing care and getting to know everything about your patient and their life. Then you can really personalize care.
Right. I mean, I know that especially for my loved one that I was caregiving for, their care team became our family. They really did. And so, that I looked at them just like I would look at family and wanted the best for them, like I would family as well. And so with that being said, Dr. Berenson, always a pleasure to see you. Cyndie, seeing you as well. I'm pretty sure I'll bother you all sometime in the future. Thank you, Cyndie and Dr. Berenson, for a great discussion today. I think Dr. Berenson is such a colorful character and really brings that humanization to cancer that we at the Patient Story continuously strive for. And I'm sure he would agree that he's pretty lucky to have such a wonderful patient like Cyndie. Again, thank you both. To wrap up this discussion, I want you to leave with the takeaway that it is important to be empowered so that you and your caregivers can make informed decisions about your care. A reminder, we want to hear from you. A survey will pop up when this program closes, so don't go anywhere. Thanks again to our sponsor, Sanofi, for its support of our independent patient program, and to our partner, LLS. Check out the links on their website, and also check out their Information Resource Center, which provides free one-on-one support. Until next time, I'm Tiffany Drummond, signing off, and on behalf of the Patient Story, thank you for watching.